My name is Rebekah and I'm the Programme Manager for the Global Psoriasis Atlas. The Global Psoriasis Atlas is a collaboration between IFPA, the ILDS and the IPC, working in partnership with the University of Manchester and the University of Hamburg. Workstream 1 have been working on a systematic review looking at the incidence and prevalence of psoriasis globally so that we can understand the burden of disease around the world. Workstream 2 have undertaken desk research looking at published and unpublished data on psoriasis around the world and are working with our regional coordinators and dermatologists to obtain this data. I started working as a research nurse about 5 years ago and I mainly worked on psoriasis clinical trials, so I met lots of people who had psoriasis, and often they had psoriasis that was really quite severe, and I was able to see how much it could impact a person's life and their whole life, and not simply just be a mild skin disease. I realised that the Global Psoriasis Atlas was coming into existence and was really interested in working on something that would have an impact on a global scale. So I'd obviously worked with individuals, which was superb, and I loved doing that. But this job gives me an opportunity to work on something that will hopefully have an impact on people around the world. In order for us to be able to understand the burden of psoriasis, so how many people have psoriasis globally, we need to carry out these kinds of studies, and the systematic review that Workstream 1 have been involved in will give us an indication of the number of people around the world who have psoriasis. The World Health Organization has been really clear about the fact that people with psoriasis should be given access to the best available treatment wherever they live in the world, and that's the ultimate ambition of the GPA. We have a global network of regional coordinators, and we're really fortunate that dermatologists that we meet and the regional coordinators that we work with are extremely enthusiastic about the Global Psoriasis Atlas and helping us to find data and to carry out new studies as well. People can get involved with the GPA in a number of different ways. So we have a number of surveys that we are completing now with Workstream 2, looking at healthcare for psoriasis treatments and also patient surveys that dermatologists can conduct in their countries. The most rewarding thing for me about being involved in the GPA is that it's a truly global project, and the enthusiasm of everybody who works on it, from our collaborating organisations to our regional coordinators and the researchers on the work streams, is superb. Ultimately, the goal of the GPA is to ensure that people with psoriasis have access to the best available care where they live. If you'd like to find out more or get involved with the work of the GPA, you can contact us via the Global Psoriasis Atlas website.